Hey everyone, welcome to Discover the OC. I'm Jules Wilson, your host and lifestyle realtor here at Seven Gables Real Estate. Listen, I'm working hard every day to help you with your real estate goals and needs, whether it be buying and selling or investing, but I'm also really passionate about supporting local business and bringing you tips and tricks on how you can make your life better, because we all need that, right, Dr. Jennifer? Well, I'm thrilled today to have Dr. Jennifer Roelands. Now, Dr. Jennifer is an MD, and you are so passionate about what you do. Listen, let's be honest. Just like there's a lot of realtors all over the place, Dr. Jennifer, there's also a lot of doctors, but you have something that's so special and so unique about you, in addition to you're an amazing person. Why don't you tell people what sets you apart, and really what is your passion for choosing to become an MD, because that's no easy road.
Yeah, so I am double boarded in OBGYN for the last 15 years, and I'm also boarded in integrative medicine or holistic medicine. So I am different in that I really try to look at prevention and reversal of disease. What I want to do is help someone figure out what is going on in their body and how can they have the tools themselves to heal themselves. Mm-hmm. In Western medicine, we often kind of focus on really, symptom equals a disease, then we give you treatment.
Right.
But not so much about how do we reverse that, or how do we allow our body to heal so we're not relying on medication forever.
Right.
So I spend a lot of time with patients trying to figure out the puzzle of what's going on.
That's right.
And it really began when my own journey, I had a very difficult time conceiving my second child. I tried for years and couldn't get pregnant.
Wow, I didn't know that.
Yeah, and so I ultimately figured out that I had Hashimoto's thyroiditis.
Wow.
And my own physician had done blood work and did the typical TSH screen and said, oh, no, you don't have a thyroid problem. But I kind of pushed the envelope and said, I swear, this is what's wrong with me. And I was able to figure out that I had antibodies were elevated, so I ultimately did have that, and that was why I was not able to conceive. And so me kind of...
Well, how did you fix that? Did you reverse that, or what?
Well, so I was put on medication so that I could have a baby.
Okay.
And then after I had my child, I was realizing that just that medication alone wasn't the answer to feeling good with the thyroid problem. I had to figure out there was more to a thyroid issue than just medication. I needed to pay attention to what I did, the stuff I put on my body, the food I ate, did I move my body, and really pay attention to those lifestyle factors. And I was able to live a better life by having dove a little bit deeper into thyroid.
And did you have to take your medication still?
I did take a medication because I later on in life I ended up having a mass on my thyroid. So my thyroid's been a hot mess for a while. But basically, I ended up having to dive a little deeper, because in medicine we don't learn anything about nutrition. As physicians, we're not taught anything about how food is medicine.
Right.
Food is just as important as the tablets that you take. And so understanding that I could help patients who are struggling just like me, who felt terrible despite doing everything their doctor told them to do.
Right.
I was able to then now say to patients, okay, I have other solutions for you.
Yeah. So what did you do now? Where are you at now on that? Because the people are going to want to know.
Yeah. Well, I mean, I have Hashimoto's thyroiditis.
Right.
I have PCOS.
Right.
That's also another thing. And then now I'm in the lovely perimenopause stage.
Oh,
so
I love that.
I'm learning a lot about that right now. I actually am certified in menopause care, but just understanding what that means for my own biology is really important. And that's what I try to teach other women and men, because I do see men, and try to help them understand, what is your biology different than the other person? How can you figure out what tools work for you? So for me, I pay a lot of attention to what I eat. I pay a lot of attention to getting outside, because it's almost like, for me, medicine, I need to see the sun.
Agreed. Yeah.
I need to be outside. I need to move my body. I work out every day, or walk at least every day. And then I really pay attention to the signs that I'm saying I'm doing too much. I never, as a physician, cared before. I always was,
push it.
Extra cup of coffee, no big deal.
Right.
Now I realize the value of sleep.
Yes.
And realize so much that my health is dependent on me doing those things every day.
Right.
And not pushing the envelope harder.
Yeah. Well, another thing I love about you is that you offer IV therapy.
I do.
And I've learned a lot from you about how that is. Not everyone hears the buzzword cleanse, right? But prevention and reversal, tell us how that might work for people, just generally.
Yeah, I mean, for someone who's really struggling with a chronic illness, IV therapy can be a great way to kickstart and get things going while we work on a better plan long term.
Okay.
A lot of patients that see me are patients who are on medications all the time, and they say, I just feel awful still. How do I get better? How do I get back to myself? How do I feel like myself again? And so a lot of times IV therapy can be a great way to get nutrients in you and vitamins in you to really kind of kickstart your health and your healing journey. and then long-term working on how can we reverse your chronic illness.
That's wonderful.
So it is, yeah, I take insurance. I do, actually all my patients see me with insurance. So even if you want to see me as a functional medicine doctor or an integrated medicine doctor, I take insurance, which is very uncommon in Southern California.
Well, that was a big deal. Now, when DrJen told me I mean, you're almost basically like a concierge physician.
Yes.
Truly.
Just not with the prices.
Right. And she takes insurance, but there's a story there about when you were growing up and going to when you eventually went to medical school, and you said it bothered you that so many people couldn't afford a concierge doctor or integrative medicine doctor, and that's why you went through all this effort to become where you would take insurance. That was a big deal, Dr. Jennifer. That's huge.
Yeah.
I mean, I still commend you. You're basically making your brain and your passion available to everybody by taking insurance. That's crazy. I mean, really.
It is crazy.
Yeah.
I mean, I feel like this type of medicine should be for everybody.
Yeah.
Everybody should have the opportunity to figure out how to heal.
Yeah.
And to be able to have somebody who's their advocate. And I don't think it should be limited to people who have more resources than other
You're
people.
awesome.
So, yeah, I'm trying to change the face of medicine, which isn't easy, but you know, we all have to be in the game if we're going to change it. So, being outside of the game, in my mind, didn't seem to be an option. So.
Well, here's the other thing about Dr. Jennifer. Now, when obviously it's not all due respect to other physicians who don't have a choice, it's not that 15-minute appointment.
No.
Am I wrong?
No.
Tell us about that, how you serve your patients.
Yeah, all my patient appointments are either 30 minutes or an hour. Sometimes they're 90 minutes, sometimes they're very long, but I can't get into someone's story or understand them without time.
Yes.
I need to listen, I need to hear their story, and 10 minutes is not going to do it.
That's right.
So I had done that for 13 years and had been in that type of medicine, and I didn't enjoy it. Patients didn't enjoy it. No one was happy in the end. So I need that time to really foster a good relationship, to understand what they're going through, and to really help them figure this out. And so all my appointments are 30 minutes to an hour. And then the IV typically is like 45 minutes to an hour.
That's amazing. Like that. I mean, I don't think I've ever heard of that, quite frankly.
Yeah.
The other thing, well, it's fantastic. Now, I know you also have a brick and mortar office in Fullerton, right? Near St. Joe's Hospital?
Yes, Fullerton on Bastion Cherry between Euclid and Harbor.
Okay, but you also have telehealth.
I do.
So you can serve patients basically worldwide if needed, right?
I have licenses in 12 states. So
wow.
A lot of different locations. So telehealth, I started as a telehealth company, have now gone into an office space to do IV therapy. So telehealth is something I'm very familiar with, and I enjoy seeing patients in Montana and Missouri and all Texas, all these other locations.
Yeah. Well, another thing I love about you is the fact that you're really kind of like an investigative reporter, Dr. Jennifer. It seems like you want to find out. You don't want to just get that prescription pad out. Once again, no offense. You want to. I mean, you would love it if people didn't have to be on medication at all. Isn't that true?
Yeah. I mean, I often say to patients, we get judged in medicine by, quality control measures, but we never get judged on how many things we can take people off of, right? I mean, how great would that be that would be a quality metric for physicians
Good
and
point.
hospitals? How many meds did you get somebody off of?
Oh, that's such a good way of looking at it.
And I feel like that's kind of the way I want to practice, the way that I think we should practice in medicine, and I hope that the change will happen in medicine, that it'll be more about having someone figure out what they can do to feel better, as opposed to, adding and that happened to me when I had a thyroid problem. I was having difficulty sleeping, and so then they, of course, put me on something to sleep, and then I was put on a birth control pill for PCOS, and then I was put on an anxiety medicine for the birth control side effects. So it was like this constant combination of always adding things for counteracting the side effects for those meds.
Right.
And I completely live in the Western world. I do Western medicine. I do prescribe medications.
Sure.
I do prescribe FDA medications, but most patients that come to me really want to figure out, is there anything they can do in addition to that, or how can they get off those medications?
Right. Yeah. Well, once again, I love the fact that you, there's value to Western medicine. Of course, you're an MD, but the integrative, holistic, all of that. Now, a lot of women also come to you, and you mentioned yourself, because of menopause. Right?
Yes.
So we don't have to be miserable during menopause, correct?
Exactly. No. And you are not crazy either.
Exactly.
That's a big thing I always tell patients, because they come into me, I feel crazy. And it's like, you are not crazy. These things are happening to your body. It feels like it's not your body anymore. And that's very common thing I hear, and I felt it for sure. I've had those changes the last 2 years and saying, what is going on here?
Yeah, right.
Bring me back that 5 years ago, Bonnie.
Right.
I'll take that one again.
Right.
But yeah, it's about really trying to understand what can someone do to feel good, because theoretically we'll spend 30 years in menopause.
That's right.
So I'm not going to feel miserable for 30 more years.
Heck
I
no.
want to feel good.
That's right.
Yeah, and there's wisdom that comes with that.
There is.
so
That's right.
We know we don't have to suffer.
That's
So
right.
Exactly. That's kind of, I see a lot of patients who I try to, again, with lots of tools in my toolbox, being an MD and having integrative medicine, I just sort of use the tools that work for them.
Love that. Well, once again, one thing I love about you is you're a wife and a mother, and you're going through menopause yourself, and so you really and also very passionate about prevention and reversal. So I can't think of a better recipe for a doctor, Dr. Jen, honestly. and you've gone to all that work of making insurance available for your patients. So I think that says a lot about you as a person. You really, really, really want to help people. So Dr. Jen, you just stand out like there's no tomorrow. So I really am so grateful to know you and what you're offering. So how can people get a hold of you? And by the way, she's so approachable. Who she is right now is who she is. I know Dr. Jen very well, and you are so approachable, and you never change. You're always just nice, kind, curious, and really want to help. So you are one of a kind, Dr. Jen. You really are.
We try to treat people like they're our own family. So you come into there, you get an IV, we put red light on you, we put on the Alexa. Like, we try to make it feel like you're here with us and we're all in our home together and we're comfortable. So same thing with my visits. I try, it's a chair, we sit down, we have a conversation, you can have some tea if you want.
Yeah.
Like, just to make it much more comfortable, because it feels a lot of times like patients feel when they come into offices that they're being rushed and being stuck to a script, and I want someone to really be able to open up what they need to say. So
and aren't you having more fun as a doctor with that also?
Way more fun.
Right?
Way better.
Yeah.
I mean, patients know so much and they teach me so much and they continue to challenge me to learn more.
We Google everything.
And I
WebMD.
And so it's good because it's keeps me young and active to have to learn these things that I need to push the envelope and understand a little bit more too.
Of course.
Yeah.
Well, tell people how they can get a hold of you.
Yeah, so I'm actually, my location is 301 West Bastion Cherry in Fullerton, California. And then I have a website called, it's www.precisionhealthmdoc.com. And then you can call us if you want, 714-272-3477. And I do a free discovery call for patients who don't really know if this is the type of medicine that they want.
Wonderful.
Then there's a free 15-minute call. They can sign up on my website and just chat with me.
Well, wonderful. Now, Dr. Jen, you are a gift. She might be the gift you've been praying for, hoping for. So give her a call. And once again, thank you so much, Dr. Jennifer. She's just another example of how life can be better.
Yes. Thank you so much.